Hello, today I'm going to be giving you some instructions on how to properly care for your teeth at home. So first off, we're going to start with brushing. So you should be brushing twice a day, once in the morning, once at night, and sometimes after meals if you feel like it's necessary. And you're going to want to do this 2 minutes every time, so 2 minutes in the morning and 2 minutes at night. And you're going to want to be gentle when you do it. You're going to want to brush lightly, and you'll want to cover all areas of the teeth. So I'm going to show you how to properly brush your teeth. So this is called the modified Bass method. And so what you're going to do is you're going to hold your toothbrush at a 45-degree angle, and you're going to make sure that you're getting the bristles underneath the gums. And so when you do this, you're going to do light strokes, and you're going to go in a circular motion, making sure the bristles are reaching underneath the gums. And so you do that about 20 times in one area, and once you complete that, you're going to brush down to remove the bacteria and brush it down away from the gums and get it out from underneath. So you'll do that for all the surfaces. And you'll also use that method, the 45-degree angle, into the gingiva, into your gum line. You'll be doing that on the inside too, and then you'll brush down all areas of the mouth, all surfaces of the teeth, and then the occlusals, where you bite your food, you'll do 20 circular motions in every single little area. And then after that, you'll rinse your mouth. Okay, and now I'm going to teach you how to properly floss your teeth. So you'll want to make sure that your piece of floss is long enough, and you'll wrap that around your middle fingers. Okay. And we're going to be using the C method today. So what you're going to do is you're going to take your floss and you're going to gently thread it in between your teeth. And you don't want to push it too hard just in case it slips and it goes into the gums, because that will cut them and it will really hurt. So what we'll be doing is just gently threading it in, and at the top of the tooth you're going to hug this tooth, and it's called the C method because it will make a C. See that? And so you'll hug one tooth all the way down into the gum line, and you'll come back up hugging that same tooth, and then you'll go to the other side of this tooth and you will hug it all the way down, all the way into the gums, and all the way back up. And you will repeat this for every single tooth in between. Once you get to the back molars, you're going to want to do the very back side of that as well, because plaque also does accumulate there. And you'll work your way down into the gums and back up. And you should be flossing once a day. It's also a good idea to be using a mouth rinse that will just reduce the levels of bacteria in your mouth, which cause cavities, which aren't good. So you can use that, and it will reach surfaces on the cheek and the tongue, and like interproximally, which means like in between your teeth, that brushing and flossing might not reach. Now I will give you instructions on how to properly care for dentures at home if you ever need them, or if a family member has them or something. So first, you should be taking out your dentures and cleaning them daily. You shouldn't be using harsh toothpaste or hard bristle brushes. You need to be using a soft bristle brush, and you can be using mild soap, or you can use a cleaning agent or paste that is like designated for dentures. When you are cleaning the dentures, you should hold them over the sink because they are very likely of breaking. So you can fill the sink with cool water, or you can put a towel in the sink just in case you do drop it. You don't want it to break, and that will prevent that from happening. Okay, when the denture is removed from your mouth, you will want to be cleaning your mouth as well, the tissues in your mouth, because bacteria can build up in between the tissues of the mouth and the dentures. So when you're cleaning your dentures, just gently be cleaning the tissues in your mouth. Okay, and when you are soaking or storing your dentures, you want to be doing that in cool water. You don't want them to be warped from hot water, and you want to be doing that in a solution that is designated for dentures, or just water. So let's do that. You shouldn't be wearing the denture to bed. You should be removing it and soaking it. And you need to keep it moist in an airtight container so it doesn't warp or dry. And you should be rinsing the dentures before you place them back in your mouth at the beginning of each day. You may have to modify your diet a little bit with dentures. For example, you should avoid sticky and gummy foods with dentures, so it might stick and you don't want that. You should also avoid hard or chewy foods, stringy foods that can get stuck in between the teeth, like stringy meats or corn on the cob that will get lodged in there. You should also avoid foods like nuts or seeds that can be like broken into small particles, which can also be lodged into the teeth and underneath in between your oral tissues and the dentures. So you may have to modify that, but overall you should be able to maintain a pretty healthy diet. Still with dentures, you shouldn't have to modify your diet too much. There are some health issues that put you more at risk for needing dentures in the future. These include HIV, AIDS, diabetes, anemia, Alzheimer's disease. That's because dry mouth or xerostomia is a side effect of some of these diseases or medications that can be taken to treat these diseases. In dry mouth, it just causes a good environment for bacteria, which causes decay, which causes tooth loss sometimes, or like needing to pull the teeth because of such severe decay. So those ultimately can result in needing dentures in the future. So I just want you to be aware of that, because you do have a couple of these in your family's health history. So just want you to be aware of that. So we learned a lot today. Do you have any questions for me?
Nope, thank you.
You're welcome.